Hey guys, sorry for the abundance of videos. I know your time's valuable, as is mine. But I wanted to bring something to your attention, and that's this book, The Addiction Treatment Planner. And I'll put some pictures on here with this video. When you're just starting out doing treatment plans, this book is a lifesaver, right? This is I don't even know. I'm guessing there's a newer version. This is the 5th edition. As you see, it says includes the DSM-5 updates. That's been a minute, right? So this is probably an older version. But the thing is it includes evidence-based interventions, right? And so you can't see this, but you can look at the picture. There's a billion of these things. Okay, not a billion, but there's at least 20 of these books for older adult psychotherapy, family, group, couples, addiction, adolescence, complete psychotherapy. There's just all kinds of pastoral counseling, suicide and homicide risk, early childhood, sexual abuse, veterans and active duty. Some of you may be very interested in that planner. These say they're $60. I don't know how much they are today because I use an electronic version that comes with my EHR, my electronic health records. But guys, this can be a lifesaver for you when you're learning how to do treatment plans, because what it does is, let's see, you're going to see in my last video, I talked about all these problem statements, right? While our diagnosis might be the substance use disorder. And I want to clarify something on that too. I can have multiple diagnoses, right? But as an LCDC, my diagnosis needs to be on substance use disorder. And in this class in particular, we just want the one diagnosis, right? So keep that in mind. Now, as a professional counselor, I can diagnose multiple diagnoses, right? But again, what's best for our client here. So as you see these things, this is an addiction planner. Yet in this table of contents, which again, I'm going to put a picture up here, says adult child of an alcoholic issues, anger, antisocial behavior, anxiety, ADHD, bipolar, borderline, childhood trauma. Let's find one that many of you might be able to relate to, like, okay, how about post-traumatic stress disorder? And I want to show you this. I don't know if you can see it or not, but where it says post-traumatic stress disorder, there's a triangle next to it, right? Can you see that? Is that coming up? Yeah. So right here, post-traumatic stress disorder, you see there's these triangles. When you see that triangle, that means it's evidence-based practices. Right? What do we know about evidence-based practices? They work best for most often. Don't make the assumption that that's the exact right thing for every single client, because you'd be doing a disservice to that one or two clients, right? But evidence-based means it's where we start for sure. It works best for most often, right? So let's go to that. Let's take a quick look, because remember, we're addiction, right? That's what we're doing, but sometimes this is part of. So post-traumatic stress disorder is 330. You're going to love this thing, man. It's a wonderful tool. So it starts out with, you have behavioral definitions, right? So here is our, as evidenced by, right? Let's say our diagnosis is alcohol use disorder, right? Our problem statement is post-traumatic stress disorder, right? Is one of our problems. Our mental health, right? We could even say mental health is part of the problem. And then, as evidenced by, client has experienced a traumatic event that involved actual or threatened death or serious injury and caused a reaction or intense fear or helplessness. Or another one, acts or feels as if trauma were reoccurring, experiences recurrent intrusive memories or dreams of the traumatic event. Anyway, you see, here's our definitions, right? Here's some long-term goals and some short-term goals. Maybe my short-term objective is describe the history and nature of the PTSD symptoms. My therapeutic intervention, number one, is going to be establish rapport with client, right, towards building a therapeutic alliance. Number two is gently and sensitively explore the client's recollection of the facts of the traumatic event. Anyway, it goes on and on. You see how this walks you through a treatment plan, literally step by step. And there's multiple things. So it's not just one size fits all, right? There's lots of things. So you see here where we get into the triangles. That means they're evidence-based. So let's say let's say learning. Okay, so one of our goals here is learn and implement calming and coping strategies to manage challenging situations related to trauma. You see here it says number 16 and 17. So we go to this side, find 16 and 17 over here, right? Those are one of the two evidence-based strategies. Teach the client strategies from stress inoculation training, such as relaxation, breathing control, covert modeling, and on and on. The second one would say assign the client to read about calming and coping strategies books or treatment manuals on PTSD, and then gives you a couple options. But you see how helpful this book can be. So look, I won't keep you, I want to keep this one very short. I just wanted to introduce you to that book by Wiley. I mentioned I use an electronic version. So in my electronic health records, I use a thing called Simple Practice. And it keeps my notes, my treatment plans, and they're all electronic. So I just literally click some buttons. And I can, it has this automatically loaded up, worth every penny, man. So guys, I hope that's helpful.